So hello everyone, we are back again. So with all the technical difficulties, so we are here again with Dr. Nivedita, understanding how AI is changing the healthcare, how AI is creating opportunities and new possibilities in healthcare. So welcome, Doctor, to the platform. It's really nice to have you here.
Thank you, Ayushi, for inviting me.
Yes. So now understanding, we are talking about AI in healthcare. What exactly is AI in healthcare?
Sure. So, firstly, Ayushi, I would really like to thank you. And I think we had some technical disturbances. So, uh, Hello, can you hear me?
Yes, I can hear you totally.
Okay. So, just a bit about myself. So, I am the director of clinical operations at Logi.ai. And just a second, I think something is popping on my screen. Uh, Sorry.
Just 2 minutes, guys.
I think it's an internet issue at my end.
Oh, okay. Okay.
So I'm getting some notifications.
No, that's fine. Till we can see you. Actually, your video is also switched off. I think so. You have done it.
My video is okay.
Your video has gone.
Okay. Now is it okay?
Yes, it's good.
So, hello everyone, and thank you, Ayushi, for inviting me. I really appreciate the efforts you are taking to create awareness in to all the doctors and the healthcare community. So, I'm Dr. Nivedita. I work as the director of clinical operations and the co-founder at Logi.ai. Logi.ai is a company. Basically, we deal with digital healthcare AI solutions. We have now reached out globally and have impacted around 10 lakhs of life currently with by creating early screening awareness and treatment. So this is what I do, and I mostly deal I work as a clinical AI specialist with understanding of the problem identification in the healthcare execution adoption, and I've worked both at private and public sectors before. I basically work with the medical data, try to create information out of it, and once this information comes, we create insights, and from the insights we try to build a AI model. So like the question was AI. So AI, it stands for artificial intelligence. And I think you can hear me, right, Ayushi?
Yes. I can totally. I will tell you when I don't.
Okay, sure. So, artificial intelligence as a product, we think that okay, this is just a technology, but it's not just a technology. It's in whole a new subject of in itself. Why? Because it works with tech, it works with business, and it works with data. So, if you just give it data, it's not going to come out as a successful subject that can be incorporated, adopted to the population. So we kind of say AI has four parts. It has the technology part, it has the business part, it has the data part, and it also has the medical consultation part.
Mm.
So AI in healthcare has applications, and it has potentials to prevent diseases or even detect any changes in a patient's medical conditions, or even diagnose patients faster, or
Mm.
provide individualized treatments. Ironically, if you see just like a theoretical background, if you want to keep, AI comes under four criterias. One is image-based analysis. This is what at Logi.ai we do. Then there is something called as speech recognition. So that is again something I'm sure a lot of us use Alexa,
Yes.
or any kind of voice command
Mm.
systems.
Mm.
That is a typical example of speech recognition. Then there is natural called as natural language processing.
Mm.
uh, a classic example would be when you are sending an email to somebody, and there is suggestions, right?
Mm.
Is an NLP. And
Mm.
then, of course, there is robotics. Now, in healthcare, we have seen robotics getting adopted. So there are two areas where it has been adopted, and it's working over there. One is surgery, right? So
Mm.
robotic surgery is a place where, why it's being used, because it's providing more, non like less invasive way of doing surgery better, which has a better precision than human hands.
Yes.
So similarly, at Logi.ai, we work on image. So when we talk about AI, there are like, two aspects to innovation.
Hmm.
One is where you are creating a product out of it, right? Which is I do. And there
Hmm.
is one where you just talk about the process or you just talk about the technology. So, what
Hmm.
do you mean by a product? A product is something which has all the four components, like I discussed with you, and now you are deploying it in the real world settings. Okay, it's
Hmm.
getting deployed, it's getting adopted. And there is a process innovation where you just make a product and you assume that it will be adopted, or maybe you just do a publication of it on a
Hmm.
study. So
Hmm.
these are the two things where you'll see a lot of studies on AI where some research paper has been done, but the effectiveness of these products is not determined. So they just
Hmm.
become another literature. But
Hmm.
when you make a product out of an AI, then
Hmm.
what you have to do is you have to really get it adopted in real world scenarios, understand the performance, and see how well it's getting used by for the purpose that it's being created.
Correct.
So yeah, does that answer your
Yes,
question?
yes, that definitely does. So now when understanding how different AI is and what exactly product, making product with AI, what you are doing is, how do you think it is now? You have mentioned that you are doing that, but how is it apart from robotics and surgeries, how is it in different ways also applied in healthcare? If you can help us understand all the different ways.
So, I think it has been about me 4 years working under this, area where I was uh, at a very nascent stage of understanding and integrating the two parts. So, working as a clinical AI specialist deals with understanding that what perspects of clinical information or clinical data or even clinical applications can be integrated with AI to produce something that is, a viable product.
Hmm.
So, based on the surveys that we did and all the groundwork, ground hunting, everything we did, I understood that there are majorly these areas where AI can really create good impact. One is monitoring of diseases, right? For example, there is a surveillance that happens by a government. For example, cataract. So one of our product is cataract, where what we do, or even let's say caries, if we are dentist out there, let's say oral cancer.
Hmm.
So government does provide a lot of funds to be utilized for surgeries or even screening, but because there is no digitized system or there is no way to screen people in a cost effective way, these screenings do not happen. So, monitoring, screening, surveillance will be highly impacted with artificial intelligence because it will automate the process. So, for example, one doctor is sitting in his office, he can mostly see 10 doctors, right? I'm talking about screening, I'm not talking about diagnosis, right?
Hmm.
Diagnosis is different. For example, why we need a screening. So for example, 10 people come who are showing some signs of early signs of oral cancer, or they are probably showing early caries in their mouth.
Hmm. Hmm.
So what AI can do is tell that, okay, out of the 10 people, the 5 people I have screened, they are high risk individuals, and you should have to take follow up or you have to refer them to the surgery. So in a population of a country like India, it's not possible that every doctor can see every patient's mouth or every patient's eyes, right? So
Hmm.
these things can really work. Consultation, treatment, and advice. So again, what kind of treatment is needed? What can be the best treatment suited? Rehabilitation, which is, for example, if you are disabled or
Hmm.
you have mental health issues, you need a constant way to touch and speak with somebody, or probably a way to let all that data information, what you ate, or for example, you are
Hmm.
a diabetic person, right?
Hmm.
Again, an example of chronic condition.
Hmm.
Capacity building, as in, so in our country, I think a lot of us know that there is a community functionary that is functioning at all the levels of PHCs,
Hmm.
or at all the sub center levels.
Yes.
When we bring AI, we kind of enable these capacity building. That is, we empower our community functionaries to automate the process.
Hmm.
Counseling, follow up, patient personalization has started coming up, where you kind of, people are wearing these watches to know if what is
Hmm.
their heart rate happening, or
Correct.
what is the sugar level, or
Hmm.
what is their hemoglobin level. So how do you kind of gather information from it? So for example, I wake up in a morning and I'm not feeling well, and I have this Apple Watch which is telling me, okay, your heartbeat is so, your oxygen saturation is so. But how do you make information out of it? Because an end user will not really understand what is an, a normal SpO2 level, or if my SpO2 level is below than the average, then what should I do, what should I be careful about? So
Hmm.
AI can actually help us integrate the entire information and tell you, okay, so see, today your these conditions or parameters don't look good, please don't go for a walk, or please,
Hmm.
inform your colleagues or friends that for today to be a bit in touch with you, so that if
Hmm.
there is any uncertain events, like with the recent things, like sudden heart attacks that has been
Hmm.
happening,
Correct.
right? So the precision medicine again, so we know in most of our medical, dental, everywhere, we follow rule for all kind of system,
Hmm.
right?
Hmm.
Where we are providing the same treatment every time. There has been issues where a chronic condition patient, although we do provide them the, for example, we want to do an extraction, right? We do tell them that, okay, come at this time, we will do the extraction if you are a diabetic or hypertensive, everything. But then there are this precise way of providing treatment is still missing at a large scale. There is no
That's true.
systematic way. So for a pregnant lady, what should be the test that she should be doing the
Hmm.
moment
Hmm.
she gets pregnant? Or for
Hmm.
example, you have an oral cancer, right? Who are the specialists you should be visiting one after the other, when you should be getting a biopsy report
Hmm.
based on your age and your habits that you're following?
Hmm.
When will be the
Hmm.
right time to do the screening? So these things comes under precision medicine. Then again, a very important thing from a country like India, where tobacco consumption is so high, so understanding the social determinants of health. So there are areas where there is very high fluorosis, there is an area where tobacco consumption is very high because farming and areca nut farming is happening.
Yes.
So, how do we kind of map the people of that area and understand the disease prevalence? Because when we understand the disease prevalence, it's easier for the government to manage a team.
Hmm.
Have a bus. So currently, the system is that they have a bus, they have the people who are screening for oral cancer or eye, but they do not know where I should be visiting first. That is a scenario in Indian system.
Hmm.
So there's a
Hmm.
government who is giving 700 crores worth of budget for cataract
Hmm.
surgery, and yet you will find that more than 60% of the people in the rural setting or maybe in the urban setting
Correct.
never got operated,
Yes.
right?
True.
So then there are like AI virtual assistants. They
Hmm.
can be again, for behavior modification, tobacco counseling,
Hmm.
remote patient monitoring. Again, rural, urban, or maybe from home if somebody wants to connect with somebody.
Hmm.
Mobile health, and then there are a lot of applications basically. But these are the applications that I have faced will create a lot of value based on my
Hmm.
experience.
Hmm. Hmm. No, you're absolutely right. It can be revolutionary for, especially for a country like India with so much
Yeah.
of population. So now understanding how it may create a change. What do you think are the domains that will have greatest impact? Surgery, you mentioned one. What are the other domains which will help, which will make it totally different? So there are a lot of, you just mentioned cancers also, the detection of early diseases. What else do you think?
Yeah, so when we talk about domains, we have to like understand who are the key stakeholders, right? So, for
Hmm.
example, when we look at the healthcare, the industry, there are three kinds of people who are involved, right? One is the hospitals or the
Yes.
clinics, everything. Second would be maybe an insurance, right? An insurance company. And then
Hmm.
there can be some regulators, like we have IMA or IDA, or similar bodies like that. And then
Hmm.
at the center is the patient. So
Hmm.
uh, in AI based applications, especially that we work on, we make patients at the center. So we are very patient centered, application. But there are other products as well who are more doctor focused. So they are more
Hmm.
into enabling help for doctors, right?
Hmm.
They want to create automatic systems or AI enabled systems that makes work of a doctor easier.
Hmm.
I work on making mostly into patient centric ways. So
Hmm.
what I observed with my thing is that the healthcare landscape area will improve drastically in next 5
Hmm.
years.
Hmm.
And there could be, of course, dental care is one part where we will definitely see a lot of change with
Hmm.
adoption, because the food habits is getting changed and drastically people are demanding more, dental care and dental knowledge information. Assisted living is a term we call it. This is basically for home health care planning. So why? Because we see a lot of children are now, not staying with their parents anymore. They either stay at
Hmm.
a very, a foreign country or at a different location, and there is a huge demand for home based assisted screenings that can
Hmm.
help the patient or the children to monitor their parents.
Hmm.
Then again, inpatient or outpatient services will be improved because automation, AI based, screening will start coming.
Correct.
There will be community health will be drastically changed. So,
Hmm.
what we are working on currently, it's more at level of community health. We
Hmm.
work with all the, PHCs, community functionaries. So that would be one part which will be highly affected. Reason being, we AI will provide cost effectiveness. Okay, so AI will only be adopted when it's either saving somebody's time or it's kind of reducing the cost. So if
Correct.
you see most of the PHCs, we do not have major medical diagnostics available or
Hmm.
laboratory test or any point of care devices because they're
Hmm.
too expensive, right?
Hmm.
And then the clinician services, volunteering services, rehab, wellness, post treatment follow ups, these things will drastically will be changing. So yeah.
Hmm. 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 No, that's true. That these these are well said. So now understanding how doctors and patients, yes, on a grassroots level will be helpful, but in general, how will be it used for all, every other patient as well as doctors, mostly doctors, how will it help?
Sure. So, there are two perspectives to it, I would say. One is the patient's perspective, right? And
Correct.
another is the doctor's perspective. So, there has been this a lot of questions around that will AI replace doctors?
Yes,
And
yes,
things
that's
like
true.
that.
That was the coming up question. Yes, but
Yes,
still, I
yes.
want you to tell this.
So, firstly, if you see, WHO says that the ratio that it advises, it's about one doctor is to 1,000 people, right?
Hmm.
But it never tells you about the burnout a doctor is going through,
Yes,
be it a dentist or be it other
any medical
issues,
profession. Yes.
right? The burnout and what should be the age limit? Can a 60-year-old doctor have the same efficiency of performing the screening or even looking at a patient compared to maybe a 20 or somebody younger at a young age? Of course, the answer is no, they cannot. So, what can AI bring in over there? So, when AI comes, there comes a concept called as automation. So the processes that were conventional, for example, even using your paper and a pen to write
Hmm.
something, or for example, you are waiting for a patient to come in your clinic and have the first level of information exchange, right? That can take you 12 to 15 minutes, and then you start the treatment. There is no way to actually get connected with your patients before he visits your clinic, provide them some kind of information. So, in India, literacy is 80%, right? Approx 80,
Hmm.
90% is the literacy. But if you talk about health literacy, which is ability to read, understand, and use healthcare information in order to make appropriate health decisions, that is completely lacking, which it's just 40% for the entire country.
Oh,
So even
very.
if a doctor is suggesting something,
Hmm.
there is 60% chance that patient is not going to follow, or maybe he'll take some, information. So when AI comes, so what we have enabled is a way to communicate with your patient, right from creating awareness to the disease. Then you do the treatment. After the treatment, you take the follow up as well, and you stay
Hmm.
connected with your patient all the time, right? So this is the patient centric approach. But when we talk about doctor centric approach, there are AI solutions that is coming. For example, automating AI based readings on digital radiographs, or even pathology slide readings. So what happens is you improve the accuracy, you improve number of screening per minute per day, right? And then you also kind of take a note of the medical errors that is happening,
Hmm.
right? So there is an increase in accountability and digitizing. Most importantly, you're digitizing the whole data.
Hmm.
So for a doctor's perspective, if I'm interested in some case and I want to take a follow up post 3 years, there are doctors who are so interested in some
Yes.
cases. For example, even somebody has done a surgery,
Hmm.
there has been things like that post surgery there's so many complications, but how much of is something we got to know about.
Hmm.
How many of us doctors took a follow up of a patient we did an RCT
Hmm.
post 6 months and tried to understand what is his issue,
Hmm.
right? So I have seen these patients who took an RCT, their RCT was complete failure, and
Hmm.
then they went to some other doctor,
Yes.
and then they again started from zero. They
Yes.
didn't come back to you and tell you that,
Yes.
sir, this RCT that you did has failed because of
Hmm.
this and this issue. They will have the assumption, okay, this doctor is not good. He has not done, even if it was his mistake. Even if it was his mistake, he'll assume, and then he'll again go to the second doctor, and the treatment starts from zero, which is
Hmm.
again the
The
extraction,
problem.
etc.,
Yes.
whatever is required.
Yes. Yes. Yes.
So, yeah, that would be the part I would say how doctors would benefit.
That's true. So connecting with your patients back is a big thing, and I
Yes.
think that way, yes, Indian system lags a bit because there are times when you want to connect back to the doctors with the patients for follow-ups and all. So as
Yes.
you mentioned, how doctors are going to and how patients are also going to get benefit with this. What is, you also somewhere mentioned data in healthcare,
Yes.
in the start of the discussion you mentioned data in healthcare, among the four things in AI. And what exactly is data in healthcare and what is the concerns around that?
Yes. So when you kind of, start your journey into AI and health tech, the first thing comes is health data, right? So an AI is like a baby, right? When it knows nothing, it's like a class KG1 student, right? And whatever you feed him, that's what he's going to learn. So AI is like currently at what stage of AI is AI can actually copy the senses of eye, senses of hearing, senses of language. So it can actually mimic our human senses. Now there is senses of smell has also come in the industry,
Hmm.
olfactory,
Hmm.
right? So these senses and even touch, right? So AI can actually sense all this, but how is AI learning this? It learns through data. Now if you just give in garbage data which is not making any sense, okay, for example, if you just try to teach a child everything and haphazardly without trying to classify the information,
Hmm.
history, geography, or just try to feed him everything, the child will get confused, right? In
Hmm.
healthcare the issue is we have a lot of data but nothing gets stored. In India specifically, there is no storage of, no digitization of any healthcare data,
Hmm.
because it's completely human in the loop system that we are following. But when we talk about AI, we have to make the data in a way that it's accessible. So there are two kinds of healthcare data. One is a primary data. For example, you come into my office and I take account of your symptoms, past medical history, and then I give you a diagnosis, right? So that is
Hmm.
primary data. But if I take some information that is being used for purpose other than those intended when they were collected, so for example, these data can be collected through internet, wearables, mobile phones, or even EHRs, which is
Hmm.
electronic health records,
Hmm.
or even the data that we can collect from genomic sequencing. These are all called secondary data. Why?
Hmm.
Because we will use this data to probably store or try to make some information out of it. So
Hmm. Hmm.
when I say information from healthcare data in a definition wise, it means aggregation of information from various sources that can be identified
Really sorry, guys. There is some internet issue happening, so and that is the reason, the audio is getting interrupted from, Dr. Nivedita's end. Just 2 seconds, she's joining back again. And
Can you hear me now?
yes, yes, I can hear you.
Okay.
Yes,
So we can start.
yes, yes, sure, sure, sure. So yes, as we were discussing.
So yeah, so where was I? Sorry. uh,
So yes, we were discussing about how data in healthcare, how is it changing? We
yes.
can collect the data from EHR and from different places. So this we were
Yeah, so the various kind of data that is available in the medical industry that is
discussing.
usually used to
Hmm,
make some information or use it for AI based
hmm,
training or any other kind of technologies that is used. One can be EHR based records that we
hmm,
have. A
hmm,
lot, again, very few hospitals and clinics are adopting, but I do
hmm,
suggest that all of us, start recording the data of the patient. There is
correct.
administrative data, there is claims data, there is disease registries, health surveys, clinical
Hmm,
trial surveys and data that
hmm,
is, works around this. So yeah,
hmm,
and the Ayushman Bharat
yes.
digital mission is also kind of insensitizing
Hmm,
this,
collection of data.
health
Yes.
data. So they are going to pay you some amount of money if you give them that data.
So this is a big thing. So all the doctors who are listening, please, if you're not collecting data, as Dr. Nivedita mentioned, do collect the data because Ayushman Bharat is actually paying you for collecting data of your patient, and it's good for you also, for future reference, for future, you know, to know what kind of cases, if there is, as doctors, we understand there are sometimes repeat and difficult cases or anything. It actually helps. So please do this. So now, as you came up to Ayushman Bharat thing, there are a lot of new things coming. There is one thing known as UHI. What exactly it is, if you can help our audience to understand, and
Yes.
how it is changing the
So
healthcare.
it comes under the same, Ayushman Bharat Digital Mission. So in the UHI, it's called as Unified Health Interface, right?
Hmm.
Over there, basically, the plan is to integrate all the hospitals, clinics, diagnostic centers on a digital platform.
Hmm.
And a patient or anybody can anytime access it. The doctors can also access it to understand the patients. Now the question is, why do we need an UHI? So I had this we created a content around this from my company where I told them that having a UHI system will actually set credibility for the doctors. So in India, as you know, there is a lot of quackery that goes on.
Hmm. Hmm. Hmm.
A lot of quackery, especially in remote areas and everything. Once an UHI system comes, people start understanding who is a credible doctor, an authentic doctor, and who is not. Right?
Correct.
Currently, that information is not there. With
Correct.
even there is a certain case that came up that in a village, somebody used a quack. Basically, he used the same injection,
Hmm.
and that actually led to spread of AIDS,
Hmm.
HIV.
Hmm.
among all the people
Hmm.
of that village. So people are not aware of what is quackery and what is an authentic a credible doctor, and this is how this will help. Also,
Hmm.
UHI systems can actually, so there are a lot of emergency cases that
Hmm.
happens, road accidents,
Hmm.
or cases where a patient has a dementia and they
Hmm.
forget to carry their records everywhere, right?
Hmm.
When you have an UHI, a patient is bound to keep all the information on the portal, so we don't have to depend upon this paper. No more depending upon paper.
Yes, yes. Now you are. There was some glitch. Yes.
So no more depending upon paper, and a patient can freely walk in. Then there's a lot of misinterpretation of data that happens. So if there
Hmm.
is a doctor A who has said something, and the doctor B of a different specialty,
Hmm.
the patient is the only mode to communicate. But when we have
Hmm.
an UHI, a doctor can anytime log in and see his past medical history, past dental history, and communicate. Also,
Hmm.
very one important thing that I always focus on is integrative care. The concept of integrative care will come, where you are no longer, this dentist is separate. So I had this one cancer case that came up to me, where a woman was diagnosed with oral cancer, and she was just being referred from one center to the other to the third. She just did round and round. Somebody saying do biopsy, somebody's doing saying do a CT scan, but there is no integrated where a patient can understand what is which step. And
Correct.
lastly, and very importantly for dentist, I feel an UHI system will tell us the distribution of the clinic. So 60% of India's population is rural based, and yet we see that most of the clinics are urban based, right? And dentists of course expect that they will get more patients and everything, but understanding the geography of distribution of a place. So if I am in a district level 1 or district level 2, how should I settle my clinics over there? Now, this information is not being taught in most of the dental colleges where you
That's
should
true.
set up your clinic, right?
No, it will all medical colleges also. It's not for dentistry,
Yes,
it's for
yes,
all
yes.
medicine also, to understand where will I get the, more patients, where there is more density.
Yes.
That is the place where you want to set up your clinic. And this
Yes.
this is a
So
huge
I
thing.
am from a dental college, so I'll be knowing more about
Yes,
what was being taught in,
yes,
like,
yes,
So
yes.
I saw where I was staying. So it was it was a hub of medical college, and I used to see many dental and clinics, medical clinics across all the same
Hmm.
area. When I
Hmm.
got to know what the stats of,
Hmm.
60% population is rural based. So
Yes.
why there is nothing over there?
Hmm.
Not just dental, there is no any other kind of healthcare, any other field of healthcare out
Hmm.
there. So yeah, UHI will actually help us to distribute the providers location. At
Hmm.
least for doctors, I think it can really help.
Hmm. Hmm. That's true. That is, and that can be revolutionary for everybody who want to set up their own practice. So now, after discussing, all of these, discussing what AI is, what is UHI, what is Ayushman Bharat, there are so many other things also, that is coming up of, understanding how, what is digital therapeutics. Digital therapeutics is also something which is coming. What do you think it is, and how, if you can explain?
So, whatever I told you about AI,
Hmm.
then AI is one part of it, but digital therapeutics will encompass all kinds of technology. It can be IoT, it can be sensors, it can be AI, it can be even blockchain. So when we combine all this technology as a course through either management, prevention, treatment of a health condition, and as
Hmm.
a result, there is even simple apps that can provide nudge behavior, or nudge behavior in the sense sending a gentle reminder of taking your medicine, right? Very important in type 1 diabetes.
Yes.
Reporting conditions, to use of even gamification, for example, to understand treating CBT, cognitive biases, right?
Hmm.
Or cognitive therapies that is
Hmm.
required for mental health related issues. So
Hmm.
a lot of kinds of positive reinforcement needs to be provided for these patients, so that they kind of train themselves to think in the right way.
Hmm.
And typically, digital therapeutics are used to help patients adopt healthy behaviors as part of the treatment. So, as you know, the only correct information a patient gets is neither through Google or ChatGPT. He only gets a correct information when he visits a clinic, right?
That's
He
true.
talks to a doctor.
Hmm.
But once he's out of it, he will have hundreds of opinions, and after those opinions, there is no way to actually connect to an authentic source. When we bring DT as a part of our subject, as a practice, we enable communications. We enable more to connect with our patient beyond our clinics.
Hmm.
So, from reminders to take medications to even active living. Uh, and even major, these, I feel, digital therapeutics will have the ability to overcome even the major constraints of,
Hmm.
clinical time or the number of beds. So we will definitely, and this is a subject and it has a very proper definition as well. So I
Hmm.
am just telling you from the ऊपर से एक होता है ना
That's true.
कि क्या है, just trying to make you
Yes. No,
understand.
I
But
can understand
that is being taught in colleges like, Stanford,
hmm.
where they have introduced this as a subject and they have made a very proper definition. हम तो मेडिकल में डेफिनेशन हमें तो रटना बहुत जरूरी है, right?
Correct. Correct.
For
Correct.
our Viva.
So yes, so understanding so deep. So there is a question from Vinny. She's asking, how can physicians gain more skills in AI?
Yes.
And any particular courses or language that you recommend? And
Mhm.
how can physician leverage use of AI to efficiently practice evidence-based medicine?
Correct. Good question. So, there are two parts to it. एक तो आप जो the course question which is out
Hmm.
there. So, see, with course, you will understand theory, right?
Hmm.
Products is something that is going to be built by a third party, right? And once it gets deployed, you will start using it. So,
Hmm.
when AI-based devices or screening tools will come, you will have to start adopting it because it will be very cost effective.
Hmm.
Courses, if courses in the sense, you can see there are so many courses out there online if you just want to have some information. But if you want to work in health tech industry, so
Hmm.
maybe you don't want to work in the clinical side, you want to
Hmm.
go in health tech, which I did. So very
Hmm.
practical solution for that would be you start your journey first by networking. What does networking means? So you start attending events where there is cross collaboration. So over there, maybe you meet some engineers, maybe some MBA grads. You try to talk to them, meet them, or maybe you should try meeting your seniors, right?
Hmm.
So there are a lot of networking events that happens. It mostly happens in places where there is an innovation hub. So what is an innovation hub? These are research based places that is
Hmm.
there in some medical colleges, like there is this LVPI for eye, then there is
Hmm.
Malla Reddy hospitals in Hyderabad. So I know what is there in Hyderabad. Then there are networking events in major IIMs of our
Hmm.
country. You can go in major IITs of the country. You should
Hmm.
go and visit and check what they are doing in the healthcare space, right? You
Hmm.
start talking to them. So this is your call. Like nobody will tell you to go. You have to do it yourself, right? Networking,
Yes.
post networking, or you can do LinkedIn. So use your social media responsibly. I would say use it to connect with people. There is so many leaders out there who are medical practitioners, and they are looking for enthusiastic people, right? So
Hmm.
there are so many people who reached out to me on LinkedIn itself.
Hmm. Hmm.
I took their interview based on their level of. So this is more like at this stage where we are. You
Hmm.
don't necessarily need a course to qualify you to be a health tech practitioner. What
Hmm.
you can do is start connecting with either these people. There are some courses also they provide currently, but personally I do not recommend that you go for course, because see, course is a way for people to maybe charge you some money, but it does not guarantee you will be employed in any health
Hmm.
tech company. So you
Hmm.
can take that very because it will not guarantee you, because course is separate, but when it comes to real practical information of the ground, you need to work on projects, right? So
Hmm.
how do you work on projects? You either get associated with these research innovation hubs, try working them, go on internship, reach out to companies and just have some do some internship with them. They
Hmm.
might just need 1 or 2 hours a week.
Hmm.
It's not like a full-time job.
Hmm.
Get into the ecosystem, start
Hmm.
connecting with people, and you will see so many opportunities they start coming.
Hmm.
But this is something, this will be more like a your call. So this
Hmm.
way you can go and start working in the health tech. Second, as a doc now, as a subject and as a course, it will come, because if you've seen CBSE has introduced AI as a course. So in even healthcare, these things will come. But as a doctor, what you can do is, if you're doing a clinical practice, there will be products out there. Start adopting them, because they will save you time and your money. If you want to get into the health tech, just follow the system that I told
That
you.
you mentioned. Correct. Correct. No, that was very, very helpful. So yes, as you mentioned, and as you discussed all of these important topics and points so correctly and so nicely, and understanding how can anybody get into health tech, or be who is interested into technology and go through it, how they can do it, simplifying their way. Thank you so much, Dr. Nivedita, for taking out time today and helping us understand everything about AI, everything about how you made your journey, and how it is going to transform a patient's as well as doctor's life. So thank you so much for taking out time. It was really very, very helpful.
Sure, sure. Thank you so much. Even after all the, technical hitches we managed to pull off.
Yes, yes. No, no, I totally agree. This was a much needed session, and I'm really happy that I connected with you and we could do this actually.
Yeah. So anybody, all my viewers, you can anytime
Yes.
reach out to me. I'm active on LinkedIn. If you have
Yes,
any
yes,
follow-up
yes. So
questions or
yes, I will definitely share her LinkedIn ID as well. If in any case, or if you want to, connect with her, you want her email ID, do let us know. We will definitely share that as well. And in case of any doubts, anything, she's there to help. And any help from my end, I'm also there. So thank you
yeah,
so
and
much for being.
one thing you should,
Yes.
we all the viewers, I request you is, Dr. Aisha, you have really great communication skills, and that is also something, talk as doctors we need to learn
Acha, okay,
from you.
thank you so much. No, no, it's just no, maybe you just learn and grow according to what you want. As you have grown as a technology person, it's just what I do. So thank you so much for the compliment. And thank you so much everyone for joining us today. It was really nice having Dr. Nivedita with us and discussing her journey, her knowledge with us. In case of any doubts, as she mentioned, you can connect with her or me and clear your doubts. Do welcome AI and adopt all the new technologies that are coming in. It will definitely change your as well as your patient's life. So
Thank you.
thank you so much, Dr.
Thank
Nivedita.
you for the opportunity.
Okay.